Hello, I'm Ireton-Paul from Guelph Osteopathy. Right now I'm going to put together a short video on a hip flexor stretch. There are quite a few muscles that do cross the hip joint here. Hip flexors are the muscles that actually raise the leg, flexing at the hip, hence hip flexor. One of the major muscles that I want to discuss is the psoas major. It attaches to the front of the femur, and it runs up through the pelvis and attaches to the front of the lumbar. So this muscle I like to call the great deceiver, because what it can do is it flexes the hip, but because it attaches to the low back, also flexes the lumbar spine. A lot of people sometimes will get, if that spasms up, will get sharp shooting pain, or they say they've thrown their back out. So, and I don't know if you've experienced it or you've seen people, they tend to kind of walk like this, and they're like, I just can't straighten up, and they feel this sharp pain in the back. The problem is not in the back in that circumstance. If it's a spasm psoas major, the problem is the muscle itself, and it needs to be addressed. Once it's spasmed, I wouldn't suggest trying to stretch it. I would go and see an osteopath and get that sorted out right away. The stretching is preventative to stop that from happening. But having said that, because it attaches to the front of the low back, it does cause, I don't know if you can see this in my low back, quite a bit of a lower dodic curve. It can really put a lot of strain on that low back. And on the back end here, where all the nerves are coming out of the spine, it kind of compresses those. The facets of each vertebrae will compress down on the nerves, causing a lot of pain, a lot of spasming. So it also can restrict your gait as you're walking, because it will bring it forward, but as you take a step with the other leg, this restriction won't allow you to take a nice full swing gait. So it causes a short, choppy kind of a gait. This can also lead to low back pain, hip pain, knee pain, ankle pain. So the hip flexors are quite important to take into consideration, especially for people like truck drivers, office workers, people who are sitting for long periods of time. The longer you're sitting, the shorter that muscle gets. So it's very important to try and elongate it, try to stretch it out, keep it loose, to make sure for leg as well as low back, pelvic health. Okay, so I'm going to demonstrate a very basic stretch that you can do at home. The most important thing with stretching any muscles, make sure it's thoroughly warmed up. Hot bath, hot shower, preferably following exercise. The other thing is that we're going to do this stretch on the floor. We're going to be kneeling down. I'm going to stretch my right hip flexor. So I'm going to be kneeling down, knee on the floor. I'm using a pad. If you're at home, I would suggest using a pillow or a cushion of some kind. I don't like seeing the knee joint getting pressed right into the floor. So try and use some kind of a padding, rolled up blanket, something to put between the knee and the floor. So my left leg is forward, my right leg is back. All I'm going to do is I'm keeping my spine straight. I'm going to just push forward and lean forward just a little bit. At the same time, I'm going to tilt the hips back. Now I can start to feel that right in this spot here. Right, I'm going to do this from the front so you can see. So I'm going to push forward, tilt. I can feel it right here. You'll want to feel that right in the front of the hip joint itself. I can actually feel the muscles tight. I can feel it pulling. So again, from the side, when I come into the stretch, it's turned off. I'm leaning forward, and now I'm tilting the pelvis back. And feel that stretching right in there. Now, if I want to increase this stretch, I'm going to raise my right arm up over my head. That causes a bit of a right side bending in the lumbar, as well as the thoracic, but I'm looking mainly for the lumbar here. And I'm going to push the hip just slightly to the right. That's going to increase this stretch as well. Again, I'll do it from the front. Have to see this from all angles. So, again, I'm going to push forward, tilt the pelvis, raise the right arm up, push the hip out that way, just a smidge. You can really feel that pulling up in this area here. So again, I would hold that for 30 seconds. Back to the side. So here, 30 seconds. Take a deep breath in. As I blow out, I'm pushing forward just a little further and tilting the pelvic back just even more. Okay, again, 30 seconds. Deep breath in. As I blow out, just ever so slightly forward more. Tilt the hips, raise the arm. Okay, and then you want to come out of this very, very slowly. And then you'll want to do the other side. So it'll be the same on this side here. Again, pushing forward, tilt the hip back, raise the arm up. So one thing I want to make clear here is that you want to feel that in the hip flexor, so right in the hip joint. You don't want to be feeling it in the low back. If you do, back out of the stretch, come back into it again very slowly. You don't want to be doing it like some people have, because this is kind of a tricky stretch to get the exact feel of. Some people will start to tilt their back and they're like, oh yeah, okay, I can feel it there. Not good. You're compressing the disc, you're compressing all the facets and jamming down on the nerves in the low back. Keep the spine neutral. Here, here, tilt. Okay? Do not lean your back. So make sure that you do that. Again, this is really good for the hip flexors for people who've been sitting for long periods of time. Make sure that, once again, I'm going to say it again, make sure you're thoroughly warmed up when you do this. And when you're done the stretch, going from the floor, you don't want to just pop right up because you've just now loosened up a joint, a major weight-bearing joint. So once you're done with the stretch, you're completed your 3 sets of 30 seconds, both knees, take a few breaths, 1 step forward. Yep, you've got your bearings. Okay, now stand up. Okay, so again, that's the hip flexor stretch. There's many different stretches you can do for this area. This is just one variation. I hope that this has helped you out. And if you want to see other variations, let me know. You can contact me on Facebook or email me at optimalfitness@hotmail.com. And I'm Brendan Ireton-Paul at Guelph Osteopathy, and I'd be happy to put together other kinds of videos if you have any requests. Bye.